There are a surprisingly high number of children who move back and forth between the child welfare and juvenile justice systems.
Researchers refer to these young people as crossover or dually involved youth. These youth have unique needs, are at a higher risk for educational and vocational challenges, deeper system involvement, and about 83% experience issues with mental health or substance use.
Since 2010, the Center for Juvenile Justice Reform at Georgetown's McCourt School of Public Policy has worked with 120 counties in 23 states to develop and implement local practices and policies to improve outcomes for children intertwined in these two systems. Children who are known to more than one system of care often fall between the cracks of those two systems. What we're trying to do with the practice models is to make sure that these systems operate in a collaborative manner.
When we leave communities, they have training, quality assurance mechanism, and a solid case management process that's going to improve the outcomes of not just young people who cross over between the two systems, but young people who are at risk for crossing over between the two.
What we want to see is indicators that show that children are doing better, that they are having greater stability in their lives, whether that be returning to home safely, being in a more permanent living situation, even if it's not returning home, seeing better educational outcomes for these young people, as well as making sure they do not penetrate deeply into the juvenile justice system.
One of the things for me that excites me about this work is that young people are getting opportunities to not just do therapeutic things, but to do things like, be involved in Girl Scouts and Boy Scouts and playing on athletic teams. Those are opportunities that young people that are in care usually don't get to experience, but via our work, we're seeing a lot of increase in that. We're also seeing a decrease in the number of young people who are being rearrested and decreases in utilization of group homing and congregate care in these communities. So we're seeing very good outcomes as it relates to youth indicators, as well as changes in how the systems that work with them are processing and working with them as well.